Hello and welcome to our monthly Community Safety and Security Live Forum here on the Serenity Resource Connector, brought to you in partnership with the JCF Area 3 Police, sponsored by National Self-Serve Wholesale there in Maypen, Clarendon. And we have a very engaging discussion lined up for this segment. We have been hearing so much about mental health, but do you know how mental health impacts safety in the community and the work of the police in the community? We're going to find out all about that in this segment as we hear from our police officer in the form of the Clarendon Safety and Security Branch, and representing the Clarendon Safety and Security Branch, we have with us Acting Superintendent of Police, Melissa Morrison. Welcome, SP Morrison.
Thank you for having me.
All right. So we are going to, let's check in with Dr. Garvey to see if she's able to hear us. Dr. Garvey, are you hearing us?
I'm not hearing you.
We are hearing you.
Oh, just a second.
All right, so we're hoping that that will be sorted out. So Dr. Dorothy Garvey Leslie is the regional psychiatrist at the Southern Regional Health Authority. Joining her, we have with us Dr. Ibalo. All right, we're having a feedback there from Dr. Garvey. So welcome, Dr. Ibalo, our parish psychiatrist for Clarendon, also with the Southern Regional Health Authority. Welcome, Doc.
Good evening. Thanks for having me.
Pleasure. And we have with us Sir Kevin Allen. If you turn on your camera and join us on screen. Sir Allen is the Acting Regional Community Mental Health Officer. All right, Sir Allen will join us in a little while on screen. So we are going to get started. I usually say, let's start from a place of understanding. So we know that mental health challenges are all around us, and our police are not immune to that. In their daily line of duty, they experience certain challenges as they seek to serve and protect us in the different areas. And so we're going to start off by seeking to get a better understanding of some of the challenges that SP Morrison and their team would have experienced in dealing with different challenges when they're called into various communities to address certain matters. So SP Morrison, talk to us about some of the challenges that your team experienced in attending to some of these challenges. Sometimes you are aware that there are mental health concerns. There are other times when you go in unaware. So talk to us about the challenges first, and then we'll take it from there.
Okay, so oftentimes when we are called to deal with persons who are experiencing emotional or mental distress, sometimes we do not receive in-depth information on what is occurring, and we will just get a report of a dispute. So we do not have sufficient information going into the situation. And it is when we get there that we are able to recognize that maybe there is more to the situation. On our arrival there, oftentimes these persons are in a heightened state of agitation, and they may exhibit aggressive or violent behavior. They may also attack the police officers, and it becomes even more dangerous if they have access to weapons or they're in possession of weapons. They may use these weapons to inflict injuries to officers, other persons who are in the vicinity, or they may even attempt to harm themselves. Depending on the nature of the emotional or mental distress, the persons may have a reduced awareness of their surroundings. They may not be able to fully comprehend the consequences of their actions. And sometimes, if there are drugs or other substances involved, this may exacerbate the situation. They may not be able to differentiate between reality and delusion, and their ability to communicate or to follow instructions may be impaired as well. There are also instances where the presence of the police itself will further agitate these individuals based on possibly previous interactions or their perception of the police. So they may become increasingly aggressive simply by the police being there. There are also instances where officers' health is placed at risk. Some of these individuals may have communicable diseases, they may have open wounds, they may attempt to bite officers, they may spit, and officers may be exposed to these diseases if they are not in possession of appropriate protective gear. So those are just a few of the challenges that we face when responding.
Some real challenges. And I trust that the wider community will have an appreciation for these matters when our police go out there, not just our police, but our responders in general, when you go out there. These are some of the things that you're faced with. But it is great that we have expertise in our midst. And so we are going to welcome Sir Alan. Sir Alan is with us now, Acting Regional Community Health Mental Health Officer with the Southern Regional Health Authority. So we want to hear now from the expert side. We're going to start at looking at how do we recognize the mental that persons are going through mental health struggles, some practical signs that we can look for, even with the police when they go in to make this determination as family members, community members, some of the things that we can actually look at. All right, let's start with Sir Alan, and then Dr. Ibalo will come in. Are you hearing on from your end? ASP, are you hearing me?
Yes, I'm hearing you.
Dr. Ibalo, are you hearing?
Yes, I'm hearing you.
Sir Alan?
Yes, I'm hearing you clearly.
Okay, so it's your time to share with us how do we spot the signs that our relatives or neighbors are experiencing or demonstrating signs of mental challenges. So we're starting with you, Sir Alan, and then Dr. Ebaloa will pick up from there.
Well, thank you so much for having us this evening. It's indeed an honor for us to be here. Well, the assessment that what we look for are some of the indicators, like for instance, a person is have not met their hygienic needs. You're also looking for the agitation, the aggression. You're also looking for the difficulty in communicating, maintaining that train of thought or maintaining that conversation that is clear. You're also looking for the level of accusation where conversation is had about persons who might not be in the environment. So they might be seeing things. Mental illnesses do affect the senses, the five senses. So they might be seeing things, hearing things, feeling things, smelling things, tasting things that are not visible to others in their environment. It is also important for us to check even in the community, even before we approach the individual, to say, is this who the person normally is? This is how the person normally operates on a day-to-day basis. can they say they have seen changes in the person? Might be a person who goes to work every day. They no longer goes to work. It might be an individual who would keep their surrounding clean. They don't. They are now hoarding garbage or hoarding things that are not seems useful to us. So these are some of the signs that you want to look for in individuals that are living with mental illness.
Seem to have lost Sir Alan there for a little while, but those are some of the signs that we look for. So, Dr. Ibalo, I want you to pick up from there as to how we can support our relatives or community members safely.
Um, Thank you. Mr. Allen was talking about the signs and symptoms of mental illness. It's important to also remember that different types and categories of mental illness. If the person is psychotic, then we have to look for psychotic symptoms. As he was mentioning, some of them being hallucination, the person having delusions, and sometimes having suicidal ideations. And of course, if we have somebody who is having a mood symptom, such as depression or bipolar, the symptoms are a little bit different. The person is either sad, happy, agitated, talking a lot, and of course, behaving erratically. And in persons who have a mood symptom, for example, depression, the person is withdrawn. Somebody who used to be lively before is withdrawn, not wanting to talk to the persons or have interaction with persons around them, and also feeling of worthlessness. And Mr. Allen mentioned not even want to bathe or get out of bed. These are symptoms that is important for the persons who are living with that individual to be aware of. And I think the first thing that needs to be done with in our community is to teach the signs and symptoms of mental of different mental illnesses. And once that is taught, then I think that, okay, if I notice that my grandma, who used to love to go to church, is not going to church anymore, she doesn't want to see her grandchildren, then yes, something is wrong. And I think that's one of the things we need to look at, the cardinal signs, and teach the community, the people in our community, signs and symptoms that they need to be aware of. And if those signs and symptoms are there, then they need to say, no, something is wrong. Let me ask more questions. And I think if those questions are asked early, and the person seeks help, there's a thing that says prevention is better than cure. Then the person doesn't have to go through the whole issue of being admitted, as the officer said, having so agitated that they're using weapons or threatening people in their community. So those are things that we need to look out first when we're talking about people in our community recognizing when a person has a mental illness.
All right. I'm glad you mentioned in terms of the different stages, because I might be going around appearing to be pretty sane, but there are some struggles there, and there are symptoms that I might not be able to recognize. But you said it's in terms of the changes in behavior. That's the first place that we start with, and those, it would be the people closest to us that would detect the difference. Correct?
Right. And also to state that, for example, if I'm having a medical illness or diabetes, my sugar can be tested, and it will see that the sugar is up. But in a person who has a mental illness, the behavior is the most important thing. The behavior is one of the things that you need to be looking at. If the behavior changes, then yes, there's something wrong, because there's nothing to state like a testing of sugar or blood pressure to say the person's blood pressure is high or their sugar is high.
Okay, amazing. All right, let's pause to acknowledge the community. We have the community here with us. Sir Thompson, I'm seeing you. Inspector Wallace supporting her squaddy. And Cecilia is saying that until she came in contact with mental health, until I've come in contact with mental health with a family member, I never realized how unsupported this is. And she's glad that we're exploring this topic. And Geraldine Phillips is happy for the topic as well. And he is here lending his support to Sir Alan. Welcome, JP McDonald, seeing you. Thank you for the others who are tuned in live. We keep it interactive, so go ahead, share your questions, your concerns as we progress through the discussion. All right, so welcome back, Sir Alan, and I trust that the connection will stay put because we want to hear from you in terms of some community well-being strategies that you've seen implemented in communities that are working that other communities can implement.
Well, when you look at community strategies that have worked for mental well-being and for assisting persons who are struggling with mental health issue, the first thing that is needed, I've seen work very well, is family support. A family member, one family member, stepping up and saying, I will be there. I will ensure that this person keeps their appointment. I will ensure that this person goes to the clinic. I will ensure that this person is contacted to say he's not turning up or he doesn't want to come. That one community member who sees it important to check in and to take the mental health team number and give them a call to say, I live beside Mr. Allen and I've not seen him gone out for his appointment. Can you come and check on him? That one church member who is checking up on that elderly person who wanders off from their house for a day and come back and nobody seems and deems it important. But that person checks in and asks a few questions. Where did you go today? What did you do? And they realize that the person is now elderly and their faculties are not intact. That one support system. I have the police officers here, and I'm glad we are in this team working together, because that one police officer who is based in the community, who understands that this young man was a hardworking young man who would go out on a daily basis, and now the state that he's in, his clothes is unkept, he's not wearing his shoes, he's not behaving as he used to. These are the resources that have worked effectively in assisting individuals and communities to be better able to manage the mental health crises that will come up. That one phone call, that one text message, that one individual who say, Jamaican people call it whistleblower or informer, but that one person who will make the connection with the police or with the mental health unit to say, I believe that my neighbor, my family member needs help. That is what has worked. And I will say again, for us to assist in mental health recovery after an episode or an experience, what we need is family, community support.
Well said. And I'm glad you shared that because the reality is there's still a stigma that's attached to mental health. So, Dr. Ibolo, help us now in understanding how we can create that supportive environment where people feel free to talk about the challenges that they're going through. Because you have issues coming out of work related stress, it comes from different angles, financial challenges. How can we create that safe environment where persons feel safe to share? And
Um,
are there such environments currently that you can share?
I think first and foremost, we need to normalize mental health issues. And we need to normalize mental health issues by having conversations. Conversations in the workplace, conversation at school, conversation marketplace, anywhere, any workplace at all, churches. We need to normalize mental health issues. And I think once persons are able to realize that, oh, it's normal to have a mental health issue, just as it's normal to have high blood pressure, then I think we'll be on the right path. Person say, yes, I have something, then I need to go and sort it out. And of course, it includes education. As I said previously, educating persons in different types of mental illness that they might encounter, the popular ones, and for them to know that, okay, these are things that I need to, once this is happening, no, let me have a conversation either with a mental health practitioner or even my church members. Because one of the things that is also being that I took part in is something that is called Problem Management Plus. In Problem Management Plus, we're teaching community members to recognize signs of mental illness, such as depression, those things that can lead to other illnesses, because somebody might be depressed and it could lead to even a more serious mental health issue. So that education is one of the things that we've done, and people are being trained in what in Problem Management Plus. I was one of, or I still am, one of the trainers of Problem Management Plus, where you teach people in the community, selected people. We started off with persons in church members. The pastor will indicate who they think that is a good candidate, and the person is trained and they get their certificate and they graduate. Also, we also need to lead by example. Everybody here, because mental illness can happen to anybody. And if we do not lead by example, I know Mr. Allen was saying, I know that Sam Sharp next door is not doing what he's supposed to do. Let me go and have a conversation with him. Let me see what is happening. And if need be, encourage him to seek help. That's one of the things that we also need to do. And resources, which is a little bit difficult in our country right now, but the resources, for example, resources such as we have the helpline people can call and get information from, or if they're having any urgent situation. And also, once they come to the hospital, if they're encouraged or they're educated that if something is happening, you come to the hospital, somebody will see you. I think that's one of the places that we need to start first. So we need to have normalized mental illness, have a conversation, teach it in the schools. We even have we are also doing education in the primary schools, because mental illness, knowing about mental illness should start from the primary school, because that will also eliminate some of the conflicts that we see coming from school, student from school.
Right, because our young people, especially our teens, they are really going through some challenging times. The beauty about it is that some of them are actually reaching out for support. I got a call and
Because
I
they
was
are being educated more. They're being
right.
educated more on the things to look out for.
Right. So it's great that they're reaching out for support. And thankfully, that list was shared so I could share the contact. Thank you for joining us, Lady Mar Noble Wint. All right. So Cecilia is sharing that she has a mentally ill brother who is not taking his meds. He was released from the hospital. They pretty much told her they don't have the resources to visit one person. And
Hold on,
continues
stop right,
here.
Stop
Let
right
me just
there.
wrap this up before you respond.
Yes.
All right, so she's continuing here to say that he's still delusional, but miraculously goes to work, but not sure how long that will last. The police alone cannot do it. We need a community of supporters, which is why we're having this collaboration here where we're bringing the police and the experts in this space. So go right ahead and respond, Sir Alan.
Right. So I'm not sure when she says that we are not available to support one person, because the community mental health unit reaches individual in the deepest rural areas of Clarendon and this island, Jamaica. We have a national program that covers 14 parishes, and it involves our clinics, our home visits where we go house to house, community to community, and it also involves our crisis response. We're in collaboration with the police and community members. We get a call, we go to the house, and we assist that individual to a treatment facility. Or if they have already been diagnosed and is on management, then we can execute treatment at their home. So I'm not sure where this person is located, but I would encourage you, come on down to the community mental health unit in Clarendon and speak to the team there. Give them the address, give them the location, and if any community you live in Clarendon, I can tell you the bus pass through at least once per month. Once per month, that bus is in your community, seeking persons, treating persons, and providing you with the necessary resource. It's a gold, long highest bus written up with the Southern Regional Health Authority on it. You can't miss it. So please come on down and share with us your concerns, and we will see how best we can assist you. But you don't have to do it alone. We are here to help you.
All
Sorry,
right.
may I interject?
Certainly. Go ahead.
Okay, it's important for the community members to also realize that it is one bus.
Yes,
One bus
one
that
bus.
does home visits, one bus that also does crisis, and we also have 5 nurses that will have to be in clinics, and every day of the week we have clinic. Monday to Friday we have clinic in one part of Clarendon, right? Resources are not there. And I think if we had more resources, more buses, more nurses, then we'll be out there in the community every day. But when you have 5 nurses with one bus, having to go through the whole of Clarendon, be at clinic, the 5 nurses at clinic, and remember, on the bus, you're expected to have at least 2 to 3 nurses, which means there's only 2 nurses left for the clinic. So I think that the community, need to realize that the resources are few, and they also need to do their best to ensure that their relatives come in as soon as possible. I go back again to say prevention is better than cure. If you see that the person is relapsing, is having those signs again, because usually when they leave hospital is because those signs that they came in are not there anymore. When you're seeing those signs coming back again, don't wait until he's breaking the window or attacking you with a machete before you start calling the crisis team. And you might call the crisis team, and the crisis team is in Moko, and you're calling from Spaldings. It makes it very difficult for us to be able to reach on time or as they would expect. I know, yes, they're having a crisis, but I think sometimes too, people out there need to be cognizant of the limited resources that we have, and that they also should do their part. Your relative is now coming to clinic.
Come and see us. Come and talk
Come
with us.
and see us. Come and talk to us.
Yes.
But not on the day that he's running after the police officer with a machete that you're going to call us. No. And I don't want him to run after any police officer, by the way. I'm just saying.
That you see why we have to have this forum, because a lot of citizens don't understand these are some of the realities that our police officers face. All right, which is why it's important. And Trinda is raising the point, a couple of points here, to say that the stigma is real and acts unwittingly as barrier to seeking treatment. And she also went on to, in terms of a point that you raised, Doc, about the initiative where you train community personnel, because given the limited resources that exist, which is what I believe Cecilia is making reference to, because that's what she would have been told by the team, the limited resources to go around. So what Trinda is saying here, if is she's asking, does this exist in other parishes, and how can this be done if not yet? I know that the South St. Catherine team, JCF South St. Catherine, had a training forum where a number of entities, it was a joint up initiative, different first responders, community members were trained, persons from police, fire, and other entities were trained in the space. So if we can
We do.
replicate this across,
Well,
then that would be great. Go ahead.
we in the southern region, we have been meeting with our police officers. We have had 1 day workshop, 2 day workshops, training our police officers, giving them the necessary information. But as we know, and ASP Morris will agree with me, that the movements is where the difficulty comes. I have trained more than 50 police officers since I've been in Clarendon as a mental health nurse practitioner. And they are no longer with us. They have transferred out. They are gone somewhere else. And it might be 3 months, it might be 6 months. They might not be there for a year. And here you have invested in a human resource that you have no control over. So that is why Dr. Balabu is saying that the new initiative now is to go to the community and to start training residents, citizens who are living in that geographical area on the early detection signs. And they are now able to give the referral and direct them. But we have continued to train. And sitting in the regional chair at this time, I am currently working with Era 3 to see how best I can put another training in place. But as you said, my fear is that these officers too might just have to relocate. But we'll keep the training going and the education on the warning signs, the early detection, and how to assist in managing mental health at the community level.
Very important. And Dr. Garvey, unfortunately, she's sharing the greeting you all to say that she's unable to get on as she would have loved to, but her colleagues are managing well. Isn't it great to have this kind of team support? Dr. Garvey, so sorry that you weren't able to get on. All right, Kelisha, senior question. Let's take this one here before we move on. She's a final year social worker doing internship now, and this is a major challenge in our country, lack of resources, and most persons are not knowledgeable of where they can get assistance. All right, it seems we need to spend a little more time, a couple more minutes on this to highlight some of the outside of the clinics, the buses going around.
All right. So
where else is there a website?
Let me start with some frank, up-to-date information. Number one, the call 888-1-LOVE is an initiative out of the Ministry of Health. The Ministry of Health has a 24-hour national mental health helpline. You can call 888-NEW-LIFE. And the number is 639-5434. persons who are suffering from substance abuse, and you can call them and they will also direct you to where you need to go. The drug abuse counseling helpline, which is 876 534 4357. 534 4357. And all our health centers are available to provide you. Our hospitals, if you call, if you walk in person, they have the telephone numbers of the mental health experts, the mental health officers, mental health nurse practitioners, our psychiatrists. Their numbers are available where you can go and get the help. So I want us to understand that 888 New Life, 888 One Love are numbers that when you call them, the government has put in place human resource at the end of, you're not talking to a computer, human resource at the end of that line to receive your information and to give you the directive. And they too will call us at the parish level to say, here is a name, a number, an address. Can you assist this individual? So these are real resources that are available to the citizens of this country, including us here in Clarendon. And then all our health centers, all our hospitals, you just need to go or call and you will get some directive on what to do. Thank you.
All right, awesome. All right, so we're not just talking to Clarendon. We have Trinda joining us from St. Anne, and I'm sure that there are some people from St. Elizabeth and Manchester, and
Well,
pretty sure if they're not on live, we have our diaspora, especially in the
any
US, that will be tuning in. So,
anywhere in Centon you are, you can
yes,
go to any one of our health centers, because the beauty about the national program, it is one model. So any parish you are in, it's the same service that we offer, is the same kind of resource, and is the same approach we take to our community mental health service that we offer.
awesome.
Hospital, health centers, get in touch with them.
All right. And just in case you missed some of those numbers, be sure to subscribe, set your notification, and share the information, because remember, we're talking about we are building out so we reduce the stigma and we're able to help those in our communities. So share the link. It will remain whether you're joining us on YouTube, Facebook, or X, formerly Twitter. The recording will remain there so you can go back and tune in. And just in case you prefer to read, there's a blog post that will be coming out on Monday that highlights the key areas, especially the resources, because this is the Serenity Resource Connector. And so you'll be able to get that information at your fingertips. Website is www.serenityresourceconnector.com. All right, Dr. Garvey was weighing in a note regarding stigma reduction. Stop labeling persons as mad. Respect them as another human being. That person is a son, daughter, teacher, husband, wife, etc. Call persons by their names. So that's one of the first places that we start in terms of stop labeling people as mad, because if that was the case, some of us who appears to be sane would fall in that category as well. It's just that we don't look like we don't reach that stage as yet. All right. Thank you so much, Randy. He likes the initiative. Go to the residents. All right. Let me see here. Tanisha, as psychologists in training, it is very heartwarming to see various stakeholders coming together to address the issue of mental health. Way to go. Thank you for that. All right. Nadia is trying to get her mentally unstable mom in an infirmary. How do I, as she's not coping on her own and will not listen to anyone?
Well,
Which parish is that, Nadia?
well, any parish
or
that
any
she's in,
parish
any
what's
parish
right.
she's in, the
Yes.
infirmary is not made for persons who are mentally unstable. So the first thing she'll have to do is to try and get her mom to the hospital for her to be stabilized. And if she has a home and she has family members, some form of support system, the infirmary is not for her mom. The infirmary is for persons who have no next of kin and is unable to function, who does not have any living arrangement. So I just want to say that the infirmary will not facilitate what she's asking for. But for stabilization, she goes to the hospital, and then as a family, they will have to come together after she's stable and assist her mom with assisted home living or in a nursing home. Thank you.
All right. So the team has a lot of work to do because already we have volunteers who are ready to be trained. I see a number of community leaders, the JPs, indicating that they are willing to be trained. All right, Nadia, St. Thomas is in the house. So take note of that. The infirmary is run by your local municipal corporation, so you can reach out to them. All right. Before we move on with the questions, Dr. Garvey is highlighting that faith leaders also need education regarding signs, symptoms of mental health condition. I think there was a comment above about casting out demons instead of seeking support. All right, so we need to be mindful of that. That is why training is so important. All right, and Cicely Goldburn, JP, good initiative as it relates to training at the community level, ready to get on board. All right. So there you have it. You have a whole list of JPs that are ready to get on board and other community members. All right. So let's take the conversation back to our police now in terms of, I'm sure you've employed a number of strategies. How have those highlight some of the practical outcomes and positive impacts that you have had based on your engagements in those cases so far?
Okay. One of the first positive impact is the reduced injury caused to individual. So we offer in our basic training for police officers a module on how to handle persons who are experiencing mental challenges. And this training allows us to engage with individuals and solicit their cooperation. So there's less likelihood of using physical force to restrain or contain or to have these persons comply with us. The other positive impact is that there is a reduced rate of incarceration. Oftentimes, when we respond to these, if we get there early enough, these persons have not yet committed an offense. And if we're able to calm these persons down, we can prevent them from committing an offense, which in that case, they would not have to be arrested. And overall, it improves our relationship with the communities. It builds their trust in us. They know that they can call on us to assist them. Community members are able to reach out rather than resorting to their own means of resolving conflicts. And it overall keeps the community safe because if community members are not aware of how to deal with these individuals or these issues, it can cause an escalation in the situation, which can result in persons being seriously injured. Sometimes they're killed. So by working with these communities, implementing the strategies, working with our medical professionals or health professionals, we're able to avert these negative impacts.
All right. So our police, they're doing their part. And we're going to move into collaboration in a little bit. And this is a good point to get there. All right, Kelisha, we need more information on social media as well, Facebook, Instagram, TikTok, etc. So here is where we all come in, where we can play a part. This 1 hour live forum that we're having here, that we have here every week, the beauty about it is that YouTube allow you to do clips. So if there's some key information that you think your community can benefit from, you can go to this 1 hour and do a clip of that and share it as a short across the different social media platforms, so you can help to spread the information. So you capture 30 seconds, 60 minutes, or you have there's this green screen feature. I know some of you younger people know exactly how to use it, where you're able to actually share a video in your video of something that Dr. Ebolo was sharing, or Sir Allen shared, or the police shared. So you can play your part in spreading the information and directing persons to source for additional information. Okay. All right. So that's one thing that you can do. And let's see, Lady Dillon, how can we get this quality information in our communities, schools, churches? Share the link for those who have, they can listen while they do their chores on the weekend, because even if they're not able to join live on a Thursday evening, most of the views for these discussions are after and primarily on the weekend. So you can listen in while you do your chores, while you're driving, and also you can invite the team, whether the police or others, to come in. This is just the beginning of the discussion here in the live forum. So you reach out to the relevant entity and invite them to come into your communities, your schools, your churches, to continue the dialogue. So we're just giving you the tip of the iceberg here. Nadia is not getting through with the infirmary in St. Thomas. So let's see how best we can provide some support there. You might have to reach out to one of those central numbers, Nadia, to get some additional support. All right. So a number of our live viewers have indicated that they love the collaboration. And this is where we're going to spend some time focusing now in terms of some examples, ASP Morrison, of collaborative efforts that the police have had with health authority and others in addressing this matter. So share with us some success stories.
In a lot of instances where persons are experiencing an episode, the police is the first point of contact. Persons will call their local police station, even before they reach out to health officials. And whenever we get these calls, in addition to dispatching our personnel to assess the situation, we also make contact with our mental health officers through the hospital. We try to gain as much information as possible so we can advise them as it relates to what happens. Similarly, whenever the mental health officers are going into the communities, they will request our assistance in providing some level of security, recognizing that there might be instances where additional support is needed. I do recall an incident in Manchester where a lady was having an episode. She threatened her tenants, and the police officers responded first. She was very agitated. She insisted that no one would enter her premises. She had a machete. The police officers tried for an extended period of time to calm her down, get her to put away the machete. She refused. And another team proceeded with the mental health officers there. We had to withdraw as police officers because it appeared as if our presence was creating a worst situation. So we withdrew and stayed at a distance sufficiently close so we could respond if the assistance was needed. And they went in and they were able to speak with her. get her to calm down, they removed her from the premises so that we could get the tenant to vacate the premises. Because for some reason she was very upset and her focus was on the tenant. So we were able to work together to have her treated as well as to remove the tenant from a potentially dangerous or threatening situation.
Awesome. All right. So, Thompson, it's truly sad to see our parents suffering from mental health issues. Truly sad. But it's not just our parents, not just the elderly. Some of our, I've seen a number of very young people on the streets, right, Sir Alan, Doctor
Oh
Ebolo?
Yes,
yes, oh
Yes,
yes,
so
yes,
yes.
it's no respecter of age. I think Doc
not at
mentioned it
all,
earlier. No
not at all.
respect of age or your status or any position. So it can happen to just about anyone. Some of us are just at the tip. Indeed, yes, we mentioned this earlier, family support, community support in general, because there are some community members who do not have any family, any blood relative.
Yes.
That's part of the reality as well. And that is where it's important for the community to come on board and support, because someone mentioned, I think it was Cecilia, that the police alone cannot do it. The health team alone cannot do it either, which is why collaboration is so important. And so we want to emphasize now how we can ensure this continued collaboration and to strengthen the collaboration between police, health experts, and the community groups in general. So we are going to go around. So we start with the King, Sir Allen, and then we are going to move around to SP Morrison, and then Doc. You'll round out with that in terms of strengthening that collaborative mechanism that we have in place.
Well, thank you. I have enjoyed working in the community. I have had persons who have run from us, who hid, not able to find them to give them their treatment. Community members rallied together. That person was restrained, placed in a safe position. The team was contacted, and we were able to go and effectively treat and take to hospital. Working with the police officers has been a tremendous help. I have gotten the position to work with the police force, the JDF, on critical cases, simple cases, and I've realized one thing, that when you love what you do it to the best of your ability. Having the police officers in Longswell Park, for example, who knows that this person needs to get his treatment, see that he's not behaving properly, secure that person in the station, call me, Mr. Allen, can you come by? Go with the police officers, effect treatment. 2 days later, the very gentleman is outside the police station, cutting the yard with his machete, cleaning up the place, and saying, thank you for helping me when I did not know that I needed help. I want to say tonight that the collaboration at every single level, family, community, individual, is key in preventing mental illnesses and also providing the support that leads to care. And remember, when individuals are getting care, we also need to be there to support them. They might lose their job, they might lose their home. A lot of things might impact them because they are now mentally ill. Can we be there to direct them to the resources like the PATH program? Can we be there to direct them towards the social services like the food for the poor? Can we assist them at our various levels, our churches, our schools? Can we simply from our homes prepare a hot meal, put it in a vessel and give to this individual, and says, here is an individual, here is a community, here is a group of persons who cares for you. My encouragement is that let us care for those who are in need, especially those with a mental illness. Thank you very much.
Well said. ASP Morrison?
All right. Dealing with mental issues it takes a community effort. And in many instances, persons the stigma attached to mental health issues, it's very great, and it can act as a barrier for persons seeking assistance. So we need to increase awareness and reduce the stigma attached to it. Another thing that is needed is for us to create support groups, especially for men. Women tend to have a greater support group. They have a greater friend group. They're expected to express their emotions. Men don't do that. They tend to suppress it. And sometimes these things can remain until persons explode. And oftentimes, when that happens, it is where when we become aware of it, persons have already been seriously injured, and it is to a point where it is difficult to contain. So I believe that we need to work together as a community to create support groups. We need to make resources available to individuals. We need to encourage others to reach out whenever they are in need. We need to offer training so that persons can also recognize the signs and how to deal with these persons. Sometimes you respond to communities and the environment that the person is in may aggravate the condition that they're having. So persons need to know how to deal with these persons whenever they're having an episode, and also to offer that level of support, to reach out to officials who are able to assist when they notice that someone is having symptoms.
Thank you for that. Dr. Evalo?
As ASP Morrison said, it takes a village. It takes a village. Somebody who has a mental health issue is not just the mental health team problem, is the community problem, is the country's problem. And what we need to do, as it takes a village, we need to start from the very very if for want of a better word, the lowest level. And the lowest level is actually taking the time to listen to that person. Be not judgmental in what they are saying. Listen to them keenly and hear their point of view, because most persons who have mental health issues, what you will realize is the behavior. Find out why they're behaving. So, what is it that is causing this problem and why now? Right? Listen non judgmentally and always, always encourage them that this is not the end. This is not the end, and the you can get help, and also the stigma. The more we educate people, the less stigma there is. And the more educated the community, and we have community members, the less people are afraid to go and ask for help. And being we also need to be our brothers keepers. If I see that Tom Jones is behaving erratically, and he's somebody who would confide in me, let me go and see what is happening. Let me offer to take him to the nearest hospital, if that is the case, because maybe his relatives are not there. Or is it that he's depressed because there's no food coming? If I can, somebody has said to me that when they're in Jamaica, he said anybody in Jamaica can die of hunger. Not if compared to somebody in the States, because there's always something there or a neighbor there that can help. We need to be able to find out, is it because you are not there's no food? Is it because of work? Is it that I can hire you as my gardener and give you and pay you for you to be able to say yes, feel fulfilled that you're working? in mental health issues, not just one thing that causes somebody to have a mental illness. There's a lot of things that cause somebody to have a mental illness, and we need to be able to talk to the person, find out what is happening, what is the trigger. And always, 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 we know that those persons with mental health issues, their social standard is always more on the lower side. If we can help them out, we need to do that. Educate ourselves more and educate the community more. And I think that is the way we are able to make to reduce the stigma in the community, to help out those who are ill or those who are relapsing from their from being stable. And if we're able to do that, I think there'll be less persons out there with mental health issues.
Well said. I see a lot of comments coming in. We are on the 1 hour mark. All right, learn, grow, invested. Education is key, and that is so important. And that's why we do this. Inspector Wallace is thanking you, Dr. Evalo. They're grateful for the facilitation whenever the prisoners are taken to the facility.
Thank you.
All
We
right.
try to facilitate them as they come, to make sure that they're in and they're out as soon as possible, because we know they have other things to do.
Oh, fantastic. A part of the collaboration, their positive poetry saying so true. We need to come together and be our brother's keeper. Mentally ill people are humans too, definitely. And remember, all right, in my wrap up, I'll share that. All right, let's give you some statistics. Doc shared some statistics here. Where did they go? Current statistics in Jamaica, 63% of persons who develop mental illness do so before age 25 years, and 35% do so by age 14 years. We must start the process developing mental minds from early childhood. And I am sure we can all endorse that. All right. Doc is not able to be on screen to be a part of the wrap up, so I will be sharing for her. So the children and youth needs the guidance of responsible adults to raise healthy children who will become more balanced individuals. Indeed. Here are some helpful apps: Calm, Headspace, Grateful, My Strides. So those are some of the apps. Some more additional resources. But remember, you can get them in the blog on Monday. Try to capture all of them in one space for quick reference.
Also, you can add mood track.
Mood track as well.
Right, for persons to track their mood, especially persons with bipolar.
Okay.
If I may,
right. So we added mood track there.
If I may interject,
certainly.
Another technique that or another method that persons can use is to, especially for parents, take a little time for yourself to de-stress.
So true.
Yes.
Put on your mask.
you if it's even an hour, one of my favorite thing to do, I have a concert in the bathroom every night. I am on stage singing away. I'll probably take half an hour, an hour, and that's my way of de-stressing. And so I'm able to take on the challenges from my family, because it's sometimes hard to be out there dealing with all of that stress, then go home and have to take on the challenges of your family. So you need that downtime. You need that self-care. So take some time for yourselves.
Indeed. You cannot pour from an empty cup. So you got to fill your cup so you can keep pouring and pouring positive influence all around. Our absolute pleasure. We all need to reset. There's a reason our creator rested on the seventh day. Sound Council. All right. So welcome. Very welcome, Marjo Mondo. All right. So there's more of this, but let me encourage you to like the video, right? Because it helps more people to see it. Share it with others who might be interested or even impacted by the topic. Because this is something that, as the statistics show, affects all of us, not just the elderly, but from the very early stages. Because I'm sure some of these, must be some signs to prove that some of these things that we're seeing manifesting at 14, 25 started from the early childhood stage and they were not detected. And so it promulgated and got to something more serious. I note the comments regarding the limited resources and the government can do more. But here is where the Serenity Resource Connector stand on that. We cannot keep looking to the government to do all these things, which is why we are focusing on the community, being our brother's keeper, being empowered, which is why we create this space where the experts will come in and share how you can help to sustain what is happening. And there are others who will come on board once they see you start this awesome initiative in your community. You'll be surprised at the level of resource that will come on board to sustain it. But if we all pull together, it can and will happen. All right, you see a lot of comments coming in, but I'm sure our panelists are tired. They've had a long day. So keep the discussions going. Thank you, Learn, Grow, Invest. Just keep the discussion going and remember to subscribe, like the video, share your comments on the YouTube page there so others can get the insights when they visit. And if it is that you're watching the replay, you did not end up here by chance. If you joined us live, you're not here by chance. You now have a responsibility to help those around you by sharing the information, using what you have learned here to be your brother and sister's keeper in your community. Reach out for additional resources for your community group so that we can all grow stronger together. All right. Thank you all so much, Dr. Ibaloa. Sir Alan looking like he's
I just want to
say
say,
something else.
I just really want to say thanks to the frontline workers, to our community health aides, to our psychiatric nursing aides, our nurses, our psychiatrists, our doctors, all our hospitals and community staff who is out there meeting the needs, and to our police officers and our partners who is out there reaching out, those from the Food for the Poor, those from Poor Relief, all the frontline workers who are taking care of the homeless, the mentally ill, those who are mentally challenged. I want to say tonight, big up, much respect, and the only reward for good work is more work. Thank you.
That is right. And it is very important that we acknowledge that. And let me acknowledge Dr. Dorothy Garvey Leslie for pulling this panel together from the Southern Regional Health Authority. Thank you so much for coming on board to make this discourse so meaningful. There are a couple of other health-related focus throughout the year that I want the health team to come on board so that we can help to empower our citizens to make your work easier, the police work easier, and the life of your first responders much easier, and by extension, the community and Jamaica. Thank you all so much again for those who were able to tune in. I see the comments coming in fast and furious. You're welcome, welcome, welcome. You all have a fantastic rest of the night.
Thank you.
Thank you.
Thank you.
Bye. Take care.